Welcome to the Adventist HealthCare and You podcast. I'm Shanna.
And I'm Nimeet.
We have an exciting episode because it is number 25.
Yay!
It sounds like there's a lot of people here. We're going to walk down memory lane and discuss the past 24 episodes and look how far we've come. When we started this a year ago or so, I don't even know, we just thought we're going to do this because it's a way to reach our community. It's a way to tell the stories of our patients and of our caregivers and raise awareness and help our community. I had no expectations, and getting to episode 25 feels really good. And we've told some really nice, really great stories and shared a lot of wonderful information.
Yeah, I mean, looking back, I'm like, oh, wow, there was a lot of time, a lot of work we've done, and it was so worth it. And I feel like we learned a lot of things, and let alone our audience.
Yes. So we've got apparently our producers have planned some activities and celebrations. So we'll see what that is.
I'm nervous.
Me too. Later in the episode, we're going to sit down with Adventist HealthCare's Chief Medical Officer, Dr. Patsy McNeil. We'll just kind of talk a little bit just about healthcare in general and what it's like here at Adventist HealthCare, what challenges that the healthcare industry is having, and what is really special about it. So stay with us throughout the whole episode.
Yeah, I'm excited to have her. So, it'll be exciting.
Yep.
But Shanna, so we have been hosting this podcast for about a year and a half now.
Yep.
We've done 24 episodes and on various topics with a lot of different experts. But just looking back, like one has to stand out to you, right? Like which one is your favorite episode out of all the episodes we've done?
I have to say, and I know it's because it was one of our last ones, but Miss Smith and her story of being a cancer survivor, I felt was so impactful and inspiring. And I just loved being in her presence and hearing her strength and her journey was very, very special. And it really made it feel like we were also part of her story.
Yeah. It's funny. I was thinking about that answer to that when I was going to ask you that question. And I was like, you know what? I know Shanna's going to say this. I know this one because it's one of my favorite episodes as well because, it's with the patient and she's telling her story with the provider being right there as well. I was thinking, what other episodes stood out to me personally? And we had a couple episodes about mental health and well-being. And there was one with Dr. Leslie specifically that we did early on. And it was right after the pandemic, and it was such a necessary topic. And I think that was probably my second favorite, I guess, after Mrs. Smith's story a couple episodes ago. But, mental health, well-being, I think we don't talk about it enough. And there were just a lot of pointers for us and lessons learned. And then we had one episode with our life work strategy manager.
On
Kathleen,
burnout.
On burnout as well.
Yes. That actually helped me personally
a
little bit work through how I was feeling about burnout and inspired me to look into it even more and find ways to help myself. So I hope our listeners got something from that one too.
And not that I'm saying any other episodes were not good.
Oh, no, they've all been excellent, right?
Yeah. I think one of the themes I've seen from all the episodes is just about preventative care and communicating with the providers and ensuring that, you are going to your doctor, having that conversation. I mean, the research has changed for every diagnosis. And, being in healthcare myself, it's hard to navigate and keep up with the research. So I think your provider has the best knowledge for that. But that means that you talk to them, have open communication with them.
Yes.
And that's kind of been our theme for most of the
I think we've learned and we've heard that it's important to remember your health. Don't put it on the back burner. Maybe it's something we just don't think about because it's who we are. We just live our daily lives and we just don't think about it unless there's a problem. But I've gotten out of the last 24 episodes to think about it and make it a priority when I need to.
Yeah, I think one of our episodes was about advanced planning or advanced directives.
Yes.
And I think that got me thinking. I was like, we should talk to our family members and have those conversations started because, quite frankly, I haven't done it
either, yes. And I did say when I got home, I think we need to talk about this.
Well, I did talk about that. I was
You
like,
did?
so we should talk about this. So my wife and I were kind of discussing it, but didn't really get anywhere. But we're hoping to get to that.
Yes.
You know?
Well, what are some topics that you think we should cover in our next 25?
That's a hard one because I feel like we've covered so many great topics. I think, talking to Dr. McNeil about the future of healthcare, what that's going to be, I think having more talks about
that's a good point.
that, talking about what the future is going to be like, because we've learned so much over the
and what
past,
innovations are happening.
and what innovations happening in other hospitals, or what can we learn from each other, what other nations are doing, and kind of how our community benefits from that and what they should be doing as part of the change.
I like that. I was thinking for what topics we should cover. To piggyback what you were saying is I want to cover more on mental health.
Yeah.
I think is a topic that continuously comes up from a lot of our experts where they just say that that's a greater issue and we need to talk more about it. So hopefully we can delve more deeply into that.
Yeah. So what is something that has surprised you or shocked you over the past, few episodes that we've learned?
I don't want to say it shocked me because I think I already knew it, but we have at Adventist HealthCare wonderful physicians and experts and people here that really make a difference.
Yeah.
And this has been such a great way to tell those stories and let our community know who they are in a very different way. Yeah. So that's what I have been most surprised about. Not that we have wonderful experts, because I already knew that, but that this is a way to let people get to know them even better.
Yeah, I think I have some similar feelings about that. I think the services we offer as Adventist HealthCare, and just getting the different speakers, right, and knowing like what do they do and how do they offer their services. Me being within the system itself, I'm not familiar with some of those services.
Yes.
So I think just knowing more about it, like, I think there was an episode on cancer wellness.
Yes.
And not for the diagnosis itself, but the mental health of the cancer patients.
The whole
as well.
person, yep.
Yeah, the holistic approach. And I think that was like kind of eye-opening for me as well, because that was something I didn't even think about, but that's something that is valued by our patients and stuff.
Oh, there's a knock at the door. Tina! Well, one of our colleagues, Tina, has joined us. Apparently, she's here for the 25th episode.
Is this a surprise for you too, or?
No, I was in on it. Your terrific crew asked me to be here, and I am so honored, you guys. And for the listeners at home, you need to know that Shanna just one day said, I really want to do a podcast, and by golly, I'm going to do it. And here we are 25 episodes later. And so congratulations.
Oh, thank you. This is not about me and Nimeet, though. This is about wanting to tell the stories that are happening here at Adventist HealthCare, because they're really special and the care and the people that we have here.
Absolutely. But I got to give credit where credit is due. So congratulations to you. And Nimeet, you are a rock star from your days at Shady Grove. I was thrilled to work with you then and to have you here sharing some of the great stories of the care we give and giving your insight.
Yes. And he's just rolled with it. We've thrown things at him and he's just been like,
I don't do anything. I just like come here and talk. And
well, who doesn't like to just come and talk? And
So congratulations to both of you for making it to 25. Congratulations to the crew that works behind the scenes on the show. And
yes, we could not do it without the producers that we have. Honestly, they do an excellent job in making us sound wonderful and gets everybody here on time and all of that.
Yeah, I think we do the easy job here.
We do.
So congratulations to all of you. And we could continue this love fest all day, but I understand we have a little trivia to play.
Oh, trivia. Okay.
Yes.
Oh my God.
So
they know I love trivia.
Yes. And
they know I don't love trivia.
So we are going to do a little bit of podcast trivia.
Okay.
To see how well you guys remember your 25 episodes.
Oh my God.
And
okay.
we have some official buzzers.
Oh, so it's a competition. Okay.
I lose.
I have full faith in you, Nimeet. You got to represent our Shady Grove
I'm gonna try.
alums here. But all right. So
don't buzz early.
I was trying to make sure it works.
So squeak to answer, I guess is what we're doing here. But here we go with the first question. Which podcast episode was the longest?
So I think it was the one with Mrs. Smith and her story.
Yes. Wasn't it Dr. Leslie's on mental health?
That was a two parts.
Oh, it doesn't
Two different
count. Okay.
episodes.
All right.
Nimeet is correct.
All right.
1 point to Nimeet.
Darn.
All right. Second question. Who was our first guest and what was the topic of the episode?
First guest was Dr. Avni Jain, and it was on getting back to the doctor.
We're going to take that answer,
Okay.
Shanna.
Was it like reset something?
Health reset.
Health
I think
reset.
See, I should get half a point for that.
I'm going to let the official scorekeepers over here settle any debates. I'm just here to ask the question. So the third question is, who closes the podcast the most? Oh, Nimeet?
China.
Yes, you are correct. It is Shanna.
Well, I think we need to change that.
I'm so afraid to do that part. But you do so well, though.
I have full faith. I think you could do it.
I
We
think you
take
could
turns.
too. Yes.
Yeah.
Okay, question number 4. Who has been the most frequent guest and how many times have they been on?
Dr. Jain? She's been on twice.
I was going to say Dr. Avni Jain, too.
Dr. Jain is the correct answer, but the number is still up for grabs.
3?
Yes.
Oh.
Yes. Well, 1 point each, I guess.
She's one of the good ones.
Yes. One of many, many in our system.
That's true.
All right. Question number 5. What day was the first podcast episode released?
Date or month?
We're looking for a full date, month, day, and year.
January 12th, 2022.
I want to say November 2022, November 15th.
Okay. We have November is correct.
Oh.
So
The
half
year
a
is
point.
wrong.
Oh, was it 2021?
November 17th, 2021.
Wow.
I didn't realize we had the podcast in 2020. I thought it was 2022. We started early.
Time
I
flies,
know.
right?
Yeah,
It's all a blur since COVID, isn't it?
it does. I think I said that at one point on this podcast. Like, I've lost track of time.
November 17th, 2021. All right, question number 6. One topic was split over 2 episodes. I didn't even get the question out, you guys. What was the topic and who was the guest?
It's Dr. Marcel Leslie on mental health well-being.
I think we both should get that answer because I gave it to him earlier.
Again, I put that to the crew here to settle any debates. Question number 7. Which expert came on the podcast to discuss colorectal cancer and is a survivor themselves?
Talking about the provider?
Yeah,
Dr. Ackerman.
No,
Provider was Dr. Ackerman, was she?
no, you missed that one. You weren't here for that episode. It was Dr. Janeja,
Yes.
Oh.
who from the White Oak Cancer Center.
Yes. Okay, now there is a bonus opportunity.
Ooh.
Here is the bonus opportunity. What was the episode number?
Hold on, I got to count.
17. Take a guess.
6,
Close. You were very close.
7.
7 is the correct answer. Lucky 7.
I had to count.
All right, this is the last question. How many episodes have had more than one guest and what were the topics?
Okay, now we have dead air, so I have to say something.
Yeah, there's slow to squeak in here.
Crickets. More than one guest. So we had Miss Smith
Yeah.
and Dr. Ackerman.
Yep.
That was one.
I know 2. I don't know if more than 2, though.
What was the other one?
It was palliative care, not palliative
Oh,
care.
yes,
the,
Dr. Young and
advanced
palliative
directive.
care.
Yes.
Yes, and
Yeah,
Dr.
advanced
Reeves,
directive.
which was
Yes.
excellent.
Yes, and then I'll give you a hint on the last one. It involves a specific time of year
Specific time of year.
and mental health.
No.
I don't know. You're okay. I don't know that one.
It is managing holiday stress.
Oh, that's right. And Dr. Jane came on that one. And Patricia Hertz from Shady Groves Fitness and Health Center. She's one of our dietitians.
Yes, our cardiac rehab.
Yes.
Yep.
All right.
That's it. So, do we have a winner? Oh, looks like Shanna ran away with it.
It was that extra one I gave you.
Well, actually, it was pretty close. It was 5-4. So
I'll take that as close.
That's good.
I'll take that as
close. Some of them were a team effort.
But that has reminded me, we've had some really nice topics. And I encourage anybody listening to this episode to go back and listen to some of those episodes. They were good.
Well, we do have a little hardware here for the winner.
Oh.
So, Shanna, you can display this trophy proudly.
Well, to our listeners listening, gorgeous trophy, episode 25 trophy.
Did the pre-ingrained with your name on it? So
it's an
so they knew who the winner was?
Podcast. No pre-name.
We'll etch it at a later date.
Nimeet and I will share it. He'll get it for 6 months. Then I can have it for 6 months.
Well, I have great news, and that is there are no losers here. So we actually have a second one.
So we don't have to share.
So
yay.
Thank you both. And we want all of our colleagues.
Thank you for coming.
Thank you for coming.
Of course. And I hope you guys will have me back for 50. We'll play some more trivia. And
I think Tina has a better voice than I do. She should guest host sometimes.
I'm here and ready.
All right. Well, I think we've walked down memory lane enough. So we appreciate all of our listeners sticking with us. Now I'd like to introduce Dr. Patsy McNeil. She is here to discuss with us the future of healthcare. Dr. McNeil is the System Chief Medical Officer for Adventist HealthCare. Prior to this role, she was the CMO at Adventist HealthCare Shady Grove Medical Center and is also an emergency room physician. And we are really excited to have you. Thank you, Dr. McNeil, for joining us.
It is great to be here.
It's our 25th episode, and we just wanted to have you on to help us celebrate, but also answer some questions about healthcare in general. It's changed in a lot of ways in the last 3 years, not only because of COVID, but other things. And we just wanted to get your thoughts on it. So let's just jump right into it. First off, why did you decide to get into healthcare in general?
You know, it's funny. I took a little bit of a circuitous route into healthcare. I had planned on, of all things, being a paleontologist, and decided once I went on my first dig that was not the way that was a great fit for my personality.
My son wanted to be a paleontologist a couple years ago, and I was like, it's going to change sometime.
It seems a lot more fun on paper.
I think so.
When I was out in the rain digging for bone the size of a piano with a toothpick. So
yep.
I will say that. But, you know, really, I've always had a bit of a heart for healthcare, even in the beginning. I was a candy striper when I was in my teens. It always was something I came back to. And really, when it came to the end of the day, I wanted to be in a profession which I would always have such deep purpose. Not that paleontology doesn't, but when you're taking care of human beings, there's nothing better than that. And that really eventually drove me into healthcare and then drove me into emergency medicine and then to leadership, frankly, and to be a chief medical officer and beyond.
Yeah, that's great. And Dr. McNeil, it's great to have you. I think it's so amazing to have you and your expertise towards the topic. I know you said that you came to healthcare with your passion towards it. Why'd you pick AHC? Why'd you pick Adventist Healthcare? And what keeps you here?
You know, I followed friends who were talking about Shady Grove. And when I got here, the culture is what has kept me here so many years. I've now been working at Adventist Healthcare in some way, shape, or form for 18 years. And the culture is just great. The people are really all in it to win it as far as the patients are concerned. There's kindness here, not only with patients and to patients, but to each other. And it stands out. It stands out compared to every other health organization I've ever worked with, frankly. And so that culture really brought me here and kept me here and keeps me here year after year because everyone here is so pulling for excellence and excellence for the patients in the communities where our hospitals and healthcare centers are.
Yeah, it really, over the years, it really just comes down to the people. It does. The people we serve, but who we are. And it just makes it a special place.
It does. I mean, we all spend so much time at work, no matter what work you do. Mm-hmm. And if you're going to spend as much time as anybody in healthcare is spending right now, especially, you want to be in the trenches with somebody you can depend on and who you enjoy, working with and you can laugh with and that you feel, able to be vulnerable with if you need to. And Adventist Healthcare is definitely that place.
Yeah, I've been in Adventist Healthcare for a little under 5 years at this point, and I think I've seen the culture here and in other organizations, and the culture here is just, I think it holds you here, and people truly, genuinely mean it. When they're saying hello to you or good morning to you, when they pass by, they're like intentionally looking at your eye and wanting to say hello to you, as opposed to as just a formality.
Absolutely.
You know?
Absolutely. And during the pandemic, you know, when things were so, the height of the pandemic, I should say, it's not as if it's completely over, but the height of the pandemic, when things really couldn't have been, they felt as if they could not have been any worse. I, at the time, was the CMO at Shady Grove, and I and that executive team and all of us were just, you know, we must protect these patients.
Yeah.
We must protect each other. We were spending 17-hour days there and doing it with no blinking because we were like, this is what we're going to do. These are our family. These are the people that we care about. You know, it's important that we do this to the top of our ability.
Yeah.
It was your moment. It was the moment to do.
It was the moment to do. I don't know if it was my moment, but it seemed like it was everybody's moment.
It was,
at the time.
yes, yes.
And as we are in, you know, this era now, you know, somewhat past the pandemic and in the newer era of hospitals and hospital settings, what are you seeing and what does the community needs to know about when to come to a hospital, what to expect when they're at the hospital, and what has changed before the pandemic versus now?
Yeah. This is a difficult question actually to answer because it varies a bit depending on the person's scenario. And I'll just say that as a setup. I'd start with this. If you have a primary care doctor, all primary care doctor offices, you know, make themselves available to phone calls, and there's somebody on call 24 hours a day. So generally, most elements you can call, they will give you a direction of where to go. You know, whether you go to the emergency department or not, or come to the office the next day, or come to the office next week. And so that's just base information I think that most people know. There are still people out there who don't have primary care doctors, though. And so when there are wounds that you can't take care of at home, when you're having chest pain, head pain, things that can be categorized even widely as life-threatening or life-compromising that are severe, I'd much prefer people come into the hospital. Now, having said that, there are always things that are, I will just confess and say, media-driven. Back in the day, I remember, multiple little things, and we'd have people come into the hospital really concerned about random things that are unlikely to happen. So try to curate that a bit. I mean, the likelihood that somebody who works in a library has Ebola, for instance, is pretty low. But when that media, drift was going there, we had people who said they'd been traveling. Oh, you've been traveling. I went to Delaware. Okay, you don't have Ebola. So literally that was a patient.
Yeah.
And so, use some common sense and things that really require one to feed into our emergency departments, especially. I will also say this, like what has changed? The pandemic, everybody has awareness of this great resignation.
Mm-hmm.
And that happens everywhere from the grocery store to the library to a factory. And so we're all feeling like supply chain problems somewhat because of this. It's no different in healthcare right now. And so the change is that, we really value our nursing resource and our physician resource. And pre-pandemic, there began to be a little bit of a slide as far as having people available in healthcare than there used to be. And it takes human beings to take care of human beings. We are not, 100 years in the future where we would be walking through an
There's
episode.
no robots.
There's no robots.
There's no Star Trek here, not
No.
right now. And so we need people. And so I think that is a change. We are doing well at Adventist HealthCare in that regard. We're able to take care of people.
Mm-hmm.
But the abundance of resource that used to be in healthcare across the board, no matter where you are, has changed. And so patience is something that I would definitely ask of the community. I would ask the community to take care of themselves. I heard a comedian talk about how America feeds its people as if healthcare is free. It's important to eat right, get some sunshine, take care of your mental health, drink fluids, do the things that we all know to do but are always drifting towards not doing, and to take care of ourselves so that health emergencies are less likely to happen.
Yeah, and that's a topic we continuously have come back to on this podcast is staying up to date with your screenings, doing little things to just stay on a good path of health and having a relationship with your physician. You said a little bit ago that call your doctor if you have any questions. That's what they're there for. And we've talked to other primary care physicians over the last 25 episodes, and we want to encourage people to have that relationship where they feel like they can call, and that they're not asking something that they don't have time for, or if they don't know, it's okay. You call.
It's okay to call, but it's also okay to take the time to have a yearly checkup. You should know what your cholesterol is.
Yes.
It's definitely something that is a predictive of your future health. If you are in the age range to do so, you should get a colonoscopy. This is a very preventable cancer. And I know that people who are reluctant to get a colonoscopy for whatever reasons of embarrassment, I know you don't want to have a colostomy. So please go and get the screening. Do these basic things that take you very little time so that in the future when you're 50, 60, 70, 80, 90, 100, which is possible these days, that you have a quality of life that's really worth seeing your children, what happens in America, technology. You want to be there for these things and be able to take care of them and take advantage of them. So just stay healthy and do the things we all know to do.
Yeah. You mentioned some challenges that the entire healthcare industry is facing. You mentioned staffing and shortages and things like that. What are some other challenges that, for whatever reason, we're talking about now? Maybe they've always existed, but we're starting to talk about them, or just have gotten worse.
I mean, there are several things that have gotten a little worse or different. The first thing I'm going to talk about, which is on a lot of physicians' minds right now, is workplace violence.
Yeah.
And it is, there's always been a little bit of workplace violence. People are at their worst moment, and people aren't always the best examples of themselves when they are the most fearful or the most distressed.
You don't feel well. Yeah.
You don't feel well. And so we understand that, but it's really kind of skyrocketed. And I have a heart for all of our nurses and docs who are closest to patient care, because that puts them in danger sometimes. Workplace violence is higher in healthcare than it is in any other field by multiple folds. And that is, difficult and a problem.
Yeah, we talk about what happens on airlines. So I feel like we talk about that a lot, but we don't hear the others. We don't hear about other industries a lot.
And that doesn't minimize the fact that folks that are on airlines also should not be subject
treated
to workplace violence.
Agree, yes.
But no one should, and that is an issue. Secondly, when I was in training, I could not have imagined the level of gun violence that we have in the United States right now. It's really alarming and distressing when you think about it going into the workplace as well as with children. But no one who's going about their day as an American really deserves that, I think. And so that is something that is a challenge, especially as we think in the future about, shortages of surgeons, anesthesiologists, other specialties. Like, if that continues to escalate at the pace it is, how we take care of those who are victims of gun violence is alarming to me. So I'll say that.
I never even thought about that as we're facing shortages, there may be challenges to just even treating victims.
Yeah, you see more patients just because of these incidents as well.
Yeah.
And complications because of these incidents.
Absolutely. My colleagues who are anesthesiologists right now, there's a massive shortage across the United States. So that the thought is that for the anticipated surgeries for the age ranges of people that are going to roll forward, it'll take 16 years to catch up with that shortage.
Wow.
So if you think about trauma centers across the United States, then think about normal, just road accidents, and then you think about gun violence that kind of bunch up at a time unpredictably. And there may not be the resource of anesthesiologists to take people to the OR. I don't want to completely alarm people, but these are real questions that need to be answered for the future. And that worries me. The third thing I'll talk about is we just have gotten towards handling and being on the tail end, hopefully, of our current COVID-19 pandemic. Infectious disease in the future, I think, is also something that is beginning to morph and change a little bit. There's a little bit of overuse of antibiotics at times. I really encourage people not to kind of, heavily ask for antibiotics when you don't really need them, as you want them to work in the future. And so, COVID-19 is one thing as far as a pandemic, but there are other infections out there too. And there are a lot of identified, I'll call them germs and bugs for the public, that weren't known when I was in medical school. And so that's changed. Now, on the positive side, there's a lot of changes that are great.
Yeah.
There's technology that has swooped into medicine that has revolutionized the way that we practice. There's innovation that, like we've never seen before. There are physicians now doing daily procedures that literally did not exist when I was in medical school and when I was in residency, which you can interpret as me being old or just things moving quickly. And it's really a combination of the two, truthfully. But things are really, really clipping forward, especially in the last 10 years in healthcare, in really exciting ways, just for the public, for the future. It's really interesting.
Yeah. There's challenges, but there's a lot to look forward to.
There is, actually.
Yeah.
Longevity.
Yes.
is in the future is going to be really interesting to look through.
Yeah.
Can you elaborate on that? Like what makes healthcare, we talked about some of the challenges within healthcare, but despite that, the great resignation affected all industries, not just healthcare, over the past couple of years. So what makes healthcare so special, and why should people pursue this in their career?
I'm going to preface my statement with a disclaimer that I am heavily biased.
So am I, if that makes you feel better.
We all are.
But it's just exciting, to be present when someone is having the birth of their first grandchild or their first child, or to be present when someone is told that their cancer is cured, or to be present to guide somebody through the most fearful point of their lives in which you can be there to support them. It's an inspiration to be able to live that way on a daily basis. And so to me, healthcare is the most exciting industry to be in. Now, I know people want to be rocket scientists, and there's some people out there who still want to be paleontologists, et cetera, et cetera. But every day, multiple times a day, you can make a difference in somebody's life in which you as an individual will never, ever be forgotten. People don't understand that. When you're standing in front of a patient at the time that is the worst of their life or the best of their life, they're going to remember you, your name, your face, what you were wearing. It's the ability to have impact on people's lives like you will not have in any other industry.
And even the small moments matter
goodness, yes.
too. Even if you're not sick or you have that relationship with your primary care doctor, where it's those small moments over the years, because you have that long-term relationship.
Absolutely.
Makes a difference too.
Absolutely. As an emergency medicine physician, I remember, walking into rooms when people were just devastated in their faces. They looked up at me as this source of information and help and aid. And I took that as a privilege and as an honor and as something that I took very seriously. And I know that at Adventist Healthcare and beyond, frankly, healthcare workers have that same investment in the other people that they don't even know to be able to make their painful or positive moments better.
Yeah.
And so, I don't know how else to express it besides that, but I think healthcare is just an amazing way to spend your life. I mean, the impact you have on the number of people you can have an impact on, you can't do that in other industries except for perhaps education. But we're more exciting. Out there, we're more exciting.
And in every role in healthcare, you can play a role in any of that. You don't have to be a physician or a nurse to really make a difference.
Not at all. I mean,
technologists in imaging and our environment, our front desk and environmental
access,
services and all of that.
Health information management.
Yes.
I mean, all of these things matter. We try to make it easy for patients to get their records, and that used to not be as easy as it is now. That is profoundly impactful on somebody who may have, for instance, a cancer diagnosis who's trying to coordinate care across the entirety of the Beltway.
Yeah.
These are impacts you make on people's lives that they don't, in moments that they won't forget.
Yeah.
So I think it's the most powerful, interesting, exciting place in industry to be within.
Well, we love your passion, and we love that you're here at Adventist Healthcare. So what can you say about Adventist Healthcare and how we're meeting the challenges and doing really great things here? Is there anything, a couple things that you can share?
I will say that I know that, our workforce development, as far as making sure that people can get access to work here, has been working very, very hard, especially in the last 3 years. I know that there is innovation happening here at Adventist Healthcare. I speak to physicians all the time that are doing really, really just amazing things. The Maryland model that we live within, which the public may not know, is a little bit restrictive as far as allowing innovation, but there's also innovation of thought. The way we deliver care here is being morphed a little bit to make sure we can meet the needs of the population. And all of that is going on here in the middle of this culture that I mentioned before that is so amazing and compelling and inspirational to work within. And so we are where everything is right now. I'm just telling you, this is the division of healthcare around the Beltway to be in right now. We're growing as well. We have our kind of flagship hospital, Shady Grove Medical Center, as White Oak Medical Center as well. We
added Fort Washington Medical Center a couple years ago.
Fort Washington Medical Center. We're in a management agreement with Howard University Hospital. We are really, really growing and getting new partners and really trying to move towards a future in which we really have a group of both people and places that allow us to move through the industry and really make an impact. And so it's really just a great company to be in
and
right now.
We're in the feel of that is a community hospital. It's not some big hospital that's hard to navigate or anything like that. We're still your community hospital that has access to, as you said, innovation, top physicians, and then the culture and the patient experience is very important. Very important.
And, even as we've grown, we've been able to kind of maintain or retain our ability to get that community feel. We still are of a size and of a structure and of a commitment so that, those who need within our company can reach us to make change. And so I think that's very unique as well. You can't necessarily say that, I don't believe, at some of our larger neighboring hospital systems that someone could easily maneuver to the top there if they needed to.
I think it goes back to what you were saying in the beginning about the culture. I think from an innovation aspect of it, we're not afraid to try things, but also trying in combination with what the community really wants and still keeping that connection with the community. And if you want to make a change, it's not too complicated. The bureaucracy is not as, cumbersome to get over to make that change.
No,
and healthcare is hard to navigate.
Yeah.
It is extremely hard to navigate. I actually have a 91-year-old mother who I coordinate care of my sister, and even with what I know, it can be really, really a climb. And so I think it's great that here we are just of a size and of a culture and of a way to try and make it as easy as possible to navigate and are open to thought. I will say, too, especially since the beginning of the pandemic, it demanded and jump-started the ability to become more flexible.
Yeah.
And so
we all learned that lesson.
We had a little bit of our own bureaucracy before, and a lot of that broke down when you had to make decisions immediately.
Yes.
And so that's been a help, actually, and we are more flexible than we've ever been.
And that might be a lesson that the entire healthcare industry may have learned, is to
I think so.
Be able to be flexible and move quickly.
I agree.
We had to. So what is one thing that you're excited about the future of healthcare?
It's funny. I have been thinking, I am excited about what I don't know, actually. And I say that, again, I said a few bits ago that there are physicians doing procedures in our hospital every other day that weren't even thought of when I was in training. We have Dr. Dimitri Sagunis and Dr. Wayne Olin, for instance, who do neuroendovascular work where if you're having a stroke, they go in and literally take the clot that's causing the stroke physically out. That was completely impossible.
Wow.
When I was in medical school and residency. In residency, they were just beginning to do the studies on the clot-busting drug, streptokinase at the time, but TPA, to be able to treat strokes as well. And a large amount of neurology, I'll just say, at the time, that was just diagnosis made and you walked away. There was nothing to treat these things. That's all changed now, which was unheard of back then. So I'm excited about the innovation that's occurring in medicine. I'm actually excited about the fact, and this is going to sound a little strange, but the shortages that are about to come in healthcare with physicians and with nursing is going to be a healthcare industry disruptor. And it's going to make us do other ways of taking care of patients. And so it's going to be difficult, but I'm excited to see what that's going to look like.
So say maybe a catalyst to another innovation.
Yeah, exactly.
It will be obligatorily so. But I think that's exciting. And I have very great belief in, and I don't want to wax too patriotic, but I am very patriotic in the ways that I think the Americans are good at innovating and changing industries as well. The world has the same problems that we have. Perhaps minus the gun violence. But, I think that we have really an opportunity here to really shake things up and make sure that we maintain and escalate the way that we care for people. So I'm excited about what I don't know how to solve right now.
I like that.
Yeah.
That's great.
Yeah.
Well, we try to ask all of our guests one last question, and that is, what is one tip that you have for our listeners to live a happy, healthy life? And I sometimes will allow two. So if you can't pick one,
I'm going to pick a category.
Okay.
So I know that there's a lot of talk and jargon around wellness, and I know that, and it's somewhat kitschy right now, and a lot of people are saying this and that, and there's industries around it. But there are basics to where you can take care of yourself to have good outcomes that we all know, and many of us don't do. Right? Get decent sleep at night. The television and the phone need to come off, and you need to get 7, 8, 9, if you can, hours of sleep. Now, if you have children, I know that gets difficult, so I'm not going to, wax poetic around that, but get some sleep. Control that part of life. It's under your control. Drink water, okay? Put the cheeseburger down. I will tell you right now, I love a good cheeseburger, but it is definitely not what I eat every day, okay? Yeah. And so you need to make sure that you get your vegetables in, those 5 servings of that a day. Some lean protein. See the sun, walk in it, walk fast or run or do whatever activities that you can. And the last thing is, community is one of the things that are known to increase longevity. So your family and friends are your family and friends, and you should, those positive aspects of family and friends that you like, spend time with that community. Those things are going to extend your life in length and in quality. By the time you see us, a lot of times that has not been done. Yeah. We're happy to take care of your heart attack. We're happy to replace your joint, fix your eye care. We'll do whatever we can. But your goal in life should be to not see us. That should be your goal in life. And there are ways that are completely under your control to be able to do that.
Happen,
yeah.
So just that's what I'd say.
Yeah. I like some of your examples. They're very relatable. 7, 8, 9 hours, just get some sleep. Do what you can. Just do what you can.
I'm still working on a couple of those. So
I know he's got a new baby.
I think you have a newborn, though. So like I said, there's a little bit of an excuse you have there that's quite valid. But the rest of us who are watching the Late Show and so forth, get those clips on YouTube later. I say, go to bed.
Well, thank you, Dr. McNeil. We so appreciate your time on coming on today and sharing with us your thoughts on Adventist healthcare and the future, and what a wonderful place this can be. So thank
Absolutely.
Yeah, thank you.
To learn more about Adventist healthcare, please visit adventisthealthcare.com. And a huge thank you to all of our listeners for tuning in each time and celebrating our episode number 25 with us. We're extremely grateful to you for listening, extremely grateful for our experts that have come on. And don't forget to subscribe so you get notifications for all our new episodes. Thank you and be well.